So in terms of healthcare costs,
Yes.
we know that it's just like any kind of commercial business.
Yes.
There are three factors which you need to fulfill, right?
Yeah.
You cannot get things which is product which is or buy something that is good, fast and cheap.
Yeah.
So like for example, if you eat at McDonald's, it's cheap and fast, you know it's not gonna be decent food.
Right.
So it's the same thing I personally feel applies to healthcare costs, particularly in private. In private, healthcare costs is not cheap. I think can be done quite fast. So sometimes you can get CT scan and scope within 1 or 2 weeks, as opposed to maybe in institution, you may take weeks before someone gets an endoscopy. Quality, I think, variable. It really depends on whether the person is good or not. But what do you guys think about cheap, good, and fast?
Yeah, I mean, I certainly agree with you. But I thought the definition of quality differ from person to person.
Correct.
So use the example that you talk about a certain fast food chain, right? We don't mention names, right? But actually, to be fair, I think the quality is acceptable at that price point.
Yes.
Right, but we cannot expect fine dining standard at the fast food chain. I mean, that's totally unreasonable. So similarly, when you look at healthcare costs, especially I can say for my own practice, I make sure that I see the patients sufficiently. That also means that the consultation can be very long sometimes, and comprehensive, looking at NEHR, looking at different things, discussing with patients, and even talking to the specialist at the same time when I'm talking to the patient. So I think John and I work quite closely with some of our patients that way as well. So with that kind of consultation, I don't think I can charge anything lower. If not, definitely, not only is not able to earn money, I probably go bankrupt very soon.
Yeah.
Right. I mean, this is it's time, right?
Yeah.
And I can't feed my staff if I were to charge low.
Yeah.
So therefore, I must confess that I don't charge cheap. In fact, I tell everybody I don't charge cheap. Even patients, I apologize to them that I can't charge cheap, and they understand that. So I think a lot of times patients know that the quality is there, they're willing to pay, and but you need to be upfront with them. You cannot shock them with a bill that is out of the world when they are not forewarned, right? Yeah. I think that's important, and of course, I feel that especially at the specialist level, sometimes a lot of it is. Not just forewarn them, but actually let them make the choice. Yeah, they must have the autonomy to decide for themselves. Some people may be willing to pay $3,000 for an iPhone, but not willing to pay $3,000 for a scope, for example. Right. But there are people who are willing to forgo the phone totally and save the money for a scope. Yeah. So really depends on people how they value quality.
Correct. It depends on how they value their health or their
the other wants and needs.
Their techwear.
Yes. That's right.
For example, I've done colonoscopy for patients removing biggish polyps.
Right.
Before I do that, I always tell them that colonoscopy can be expensive. Are you okay to go ahead?
That's right.
Especially those people who have no insurance. And I always tell them it can be quite expensive. Then I will say how much, and then so I give them the range of the price. And then it's just to build the expectation that I'm not here to scam you, to rip you off, but this is the standard cost. I think you need a scope. Unfortunately, you don't have insurance. And obviously, a lot of these patients come from restructured hospital. They say, I cannot wait for 3 months for the next appointment. I really need to get things done.
Right.
So I always tell them, I'm so sorry, but this is the cost. Are you okay to go ahead?
Yeah.
And most of the time, I think a lot of private specialists out there also, they will see the patient in front of them and they will give appropriate discounts or concessions because we know, for some of us the life is a bit tough, and we always try to help. I think at the end of the day, we all doctors, we all try to help our patients.
Right.